Bismillahirrahmanirrahim. Students, this is the last lesson of your chapter Coordination and Control, and in this lesson I will describe about disorders of nervous system. So disorders of nervous system can be categorized into two main types: vascular disorders, for example paralysis, and functional disorders, for example epilepsy. Vascular disorders are due to any disturbance in the blood supply to the nervous system, and functional disorders are due to disturbance in nerve impulse generation and transmission. And now I will describe about paralysis. Paralysis is the complete loss of function by one or more muscle groups. It is most dangerous one, and it is caused by damage to the central nervous system that comprises of brain or spinal cord. The damage may be due to hemorrhage, stroke, that is rupture in a blood vessel of brain or spinal cord, blood clotting in these vessels, or poison produced by polioviruses. Patient may have weak paralysis throughout his or her body, or have paralysis in a side of body. There may also be paralysis in the lower extremities or in all four limbs. The next disorder is epilepsy. Epilepsy is a nervous disorder in which there is abnormal and excessive discharge of nerve impulses in brain. It causes unprovoked seizures in patient. A seizure of epilepsy is a temporary abnormal state of brain marked by convulsions, and there is no known cure for this epilepsy, but medicines can control seizures. In younger people, epilepsy may be due to genetic or developmental causes. People of over 40 years age may suffer from this epilepsy. Brain tumors are more likely to cause epilepsy. Trauma and central nervous system infections may cause epilepsy at any stage. So, brain tumor and trauma may cause epilepsy. I have discussed earlier that there is no cure for this epilepsy, but medicines can control this disorder. Patients of epilepsy have to take medicines daily for the treatment as well as prevention of seizures. These are termed as anticonvulsant or anti-epileptic drugs. During these seizures, as you can watch here, here is an attack over these individuals. So objects should never be placed in a patient's mouth as it can result in serious injury, and it is possible that the patient will bite his or her own tongue. How horrible it is. Just think about that, how blessed you are. You are not suffering from these diseases like paralysis, trauma, seizure attack, and horrible disease, or you can say disorder like epilepsy. Alhamdulillah. The knowledge of the composition and functioning of nervous system has helped men in the diagnosis and treatment of nervous disorders including paralysis and epilepsy. Main has discovered the areas of brain that receive information from different sense organs and the areas that send messages to different effectors. Such knowledge helps a lot in identifying the malfunctioning areas of brain. And this is the home task for this lesson. You have to read and memorize concepts from textbook pages 51 to 52. Praise Allah Almighty for His mercy upon you and for that health that has given to you by Him. Thank you and have a nice day.